Hi everyone, today I am doing this video about high yield topics in immunization. According to National Immunization Schedule, which vaccine need to be given in a child of 10 years of age? Let's see about the immunization schedule. At birth, we have BCG, OPV 0 dose and hepatitis B birth dose. At 6, 10 and 14 week, we have the same combination of vaccine, OPV, pentavalent and rotavirus 1, 2 and 3. And at 6 and 14 week, we have fractional IPV and pneumococcal vaccine 1 and 2. Then at 9 to 12 months and 16 to 24 months, we have MR and JE 1 and 2. And we have the booster dose of 6 and 14 weeks in 9 to 12 months. That is the PCV booster and fractional IPV third dose. Then we are starting the vitamin A first dose in 9 to 12 months. After that, every 6 months up to 5 years, vitamin A is given. In 16 to 24 months, we also have DPT booster 1 and OPV booster. In 5 to 6 years, we have DPT booster 2. In 10 year and 16 year, we have TD vaccine. And in pregnancy, we have TD1 followed after 1 month by TD2 or TD booster if TD vaccination taken within previous 3 years. And the latest vaccine which was introduced in National Immunization Schedule is fractional IPV third dose, just introduced in 2023, and it is given in the 9 to 12 months. Let us see the routes of different vaccines. Just remember this one-liner. Intramuscular and subcutaneous vaccine are given 0.5 ml and intradermal vaccine are given 0.1 ml. The two oral vaccines are OPV and rotavirus vaccine. OPV is in a dose of 2 drops and rotavirus vaccine is given in a dose of 2.5 ml or 5 drops in a pre-filled syringe. Now the different intramuscular vaccines are hepatitis B, pentavalent, DPT and pneumococcal vaccine, and all are given in the anterolateral mid-thigh. Now the subcutaneous vaccines are MR vaccine and JE vaccine. MR vaccine is given in the right upper arm and JE vaccine is given in the left upper arm. Now there is intradermal vaccine such as BCG, which is given on the left upper arm, and fractional IPV, which is given on the right upper arm. And let's see which are the live attenuated vaccines. They are BCG, OPV, rotavirus, MR and JE. Pneumococcal vaccine is conjugate vaccine. Pentavalent and DPT vaccines are combination vaccines. Fractional IPV, as the name suggests, it is inactivated or killed vaccine. Hepatitis B is a recombinant or subunit vaccine. Coming back to the question, typhoid is not a part of National Immunization Schedule. Inactivated polio vaccine is given at 6 week, 10 week and 9 to 12 months. BCG is given only up to 1 year of age. So the answer is TD vaccine, which is given at 10 years, 16 years and pregnancy. You are posted at a PHC and you have to ensure routine vaccination process is carried out smoothly. All the following vaccines are given at 16 to 24 months except. So we know that DPT booster is given at 16 to 24 month, OPV booster is given at 16 to 24 month and JE second dose is also given at 16 to 24 month. and PCV booster, which is the answer, is given at 9 months. Mission Indradhanush is 4. The current one is Intensified Mission Indradhanush 4.0, launched in 2022, conducted in 3 rounds, 7th February, 7th March and 4th April. There are 12 vaccine preventable diseases covered in Mission Indradhanush 4.0, which are diphtheria, pertussis, tetanus, polio, childhood TB, hepatitis B, Haemophilus influenza B, rotavirus, JE, pneumococcal, and measles rubella. The Mission Indradhanush was launched in 2014, and Indradhanush means a rainbow, so it covers 7 vaccine preventable diseases, which are diphtheria, pertussis, tetanus, childhood TB, polio, hepatitis B, and measles. The goal of Mission Indradhanush was to provide full immunization against life-threatening diseases to missed out and left out children and pregnant women who are not covered during immunization rounds, to achieve full immunization of at least 90% of the children by 2020. Intensified Mission Indradhanush does not include. We know the vaccine. There are 12 vaccine preventable diseases in Intensified Mission Indradhanush, which are BCG, DPT, OPV, hepatitis B, HIP, rotavirus, JE, MR, and PCV. So the answer is meningococcal meningitis. A 3-year-old completely unimmunized child comes to an immunization clinic at PHC for the first time. He should receive. Let us see the approach towards an unimmunized child. In an unimmunized child, BCG can be taken up to 1 year and pentavalent can be taken up to 1 year. OPV can be taken up to 5 years. MR and vitamin A can also be taken up to 5 years. DPT can be taken up to 7 years and JE can be taken up to 15 years. The second and third doses of OPV or pentavalent or DPT can be taken at 1 month intervals. And the booster dose of OPV or DPT, it should be taken 6 months after the third dose. MR2 is taken 1 month after MR1. If a baby is late for a dose, we should not restart. Instead, pick up where the schedule was left off. Coming back to the question, it is a 3-year-old completely unimmunized child. BCG can be given only up to 1 year, so these two options are ruled out. DPT1 can be given up to 5 years. So the answer is vaccine contraindicated in pregnancy. To solve these, let us see the vaccines during pregnancy. The safe vaccines during pregnancy are the mnemonic is HIT rabies, hepatitis A and B, influenza, tetanus and rabies. The contraindicated vaccines during pregnancy are BCG, smallpox, chickenpox, MMR and OPV. All these are live attenuated vaccines. The vaccination given during epidemic are pneumococcal vaccine, cholera, meningococcal and typhoid. The mnemonic is PCM tablet for vaccines given during epidemic in pregnancy. Vaccines given when travel to endemic area otherwise contraindicated are yellow fever, JE and inactivated polio vaccine. So, all live vaccines are contraindicated in pregnancy except yellow fever vaccine. And all killed vaccines can be given during pregnancy. Coming to the answer, we know that hepatitis A and B are killed vaccines and are safe during pregnancy. Now what about measles? Measles is a live vaccine, so contraindicated in pregnancy. So it can be an answer. And what about MMR? It is also live vaccine and contraindicated during pregnancy. The best answer is MMR because in measles, the antibodies produced are only in picogram amounts, whereas due to the rubella component, the MMR is having more antibody production. So the answer is MMR, and we know that if there was yellow fever option, it is contraindicated based on the risk versus benefit during pregnancy. During travel, we give yellow fever vaccine, otherwise it is contraindicated. And when MMR is given, congenital rubella syndrome can occur in the baby. And when varicella vaccine, which is also a live attenuated vaccine, it is contraindicated in pregnancy, it gives rise to congenital varicella syndrome. Vaccine not to be given in patient with egg allergy is, so we have to know about the egg containing vaccines, which are influenza and yellow fever. So the answer is influenza vaccine. The least heat sensitive vaccine among the following is. You can see an ice-lined refrigerator. The bottom part is the coldest part of the ILR, where OPV is stored. Above that, MR vaccine, then BCG, JE vaccine, rotavirus vaccine. In the middle part, we have TD vaccine, DPT vaccine, pentavalent vaccine, then IPV and pneumococcal vaccine and hepatitis B. And on the topmost part, we have the diluents. The vaccine sensitive to heat and vaccine sensitive to freezing is given. The most sensitive on the top part and the least sensitive on the bottom. So, the most heat sensitive vaccine is BCG after reconstitution, then OPV, followed by MR, rotavirus, JE, DPT, then BCG before reconstitution, TT, pentavalent, hepatitis B and pneumococcal. So, if the question is the most heat sensitive vaccine and BCG, OPV are given as options, so the answer is OPV. Only if after reconstitution or before reconstitution like that is mentioned, we take the BCG into account. Now the vaccine sensitive to freezing. Most freeze sensitive vaccine is hepatitis B followed by pneumococcal, penta, IPV, DPT and TT. Now, you can see this is how the vaccines have to be kept during a routine immunization session. So, the vaccines kept on the ice pack are JE, measles, rotavirus, BCG and OPV. All these are heat sensitive vaccines. And the vaccines kept without an ice pack are TT, IPV, pentavalent, pneumococcal, DPT, like that. So, the least heat sensitive vaccine among the following is. The answer is hepatitis B vaccine. So, it is the most freeze sensitive vaccine and least heat sensitive vaccine. DPT vials are stored in the dash compartment of ILR. So, we saw the ILR in the previous slide and it was stored in the middle rack of the main compartment. Which of the following parameters is used to determine the sensitivity of vaccine due to heat? The vaccine vial monitor is used to assess the heat sensitivity of the vaccine. The vaccines containing the first two VVMs, that is the inner square lighter than the outer circle, these vaccines can be used. The vaccines with VVM in third and fourth, where the inner square and outer circle are of same color, cannot be used, and the inner square darker than the outer circle, this vaccine also cannot be used. Heat sensitive material is present in the VVM, which react to the cumulative exposure of the heat. So when more and more heat is exposed, the color of the inner square is darkening and darkening, and finally it will reach a discard point, either equal colors or darker color of the inner square when compared to the circle. The VVM is present on the label or the neck of the vaccine vial. Now there is a shake test which assesses the free sensitivity of the vaccine. It is usually done for adsorbed vaccines like DPT, DT, TT, pentavalent vaccine and hepatitis B. Here a control vial which is deliberately frozen is used, and it is compared to the test vial. If the test vial has uniform cloudy appearance without sedimentation, then the vaccine is usable. That is, the shake test is passed. And if when compared to the control vial, the test vial has more sedimentation, then the shake test is failed and we cannot use the vaccine. The answer is VVM or vaccine vial monitor, which determine the sensitivity of vaccine due to heat. At the end of an immunization, you found that a reconstituted BCG vaccine vial has around 2 doses left in it. What should be done in such a situation? Open vial policy is a concept of reusing partially used multi-dose vials of applicable vaccines. They can be used up to 28 days in subsequent immunization sessions, but it is subject to certain conditions. The expiry date should not have been passed. The aim of open vial policy is to reduce vaccine wastage. Open vial policy is applicable to all T vaccines, TT, DPT, pentavalent, hepatitis B, OPV and IPV. Oh, open vial policy is not applicable to freeze-dried vaccines which are available in powder form. They have to be reconstituted with a diluent. They are also called lyophilized vaccines. They are BCG, JE, measles and rotavirus. These vaccines can be used up to 4 to 6 hours. Open vial policy is not applicable for BCG vaccine. So, we have to discard it after 4 to 6 hours. The first option says to reuse the remaining 2 doses. It is a wrong answer. Then B and C tells to discard the vial. Both can be right answer. And D option tells to take decision depending on the vaccine vial monitor status. Vaccine vial monitor is for the heat sensitivity of the vaccine. So it is also a wrong option. Now we have to decide between B and C. For that, we have to know about the biomedical waste management. I have a PPT in SlideShare on hospital waste management. I'll put the link in the description. So, we know that the blue colored bin is for sharp waste, that is ampules, metallic implants like that. And the red colored bin is for recyclable contaminated waste. So, which means that we have to discard the BCG vaccine vial in the colored bin. A 30-year-old person traveled to Africa. He reported fever followed with chills. Which vaccine, if he had taken before travel, he could not have developed the disease? What is the strain of the vaccine? The person traveled to Africa and fever followed with chills. So the disease can be yellow fever, and we have to know the strain of the vaccine. So I have borrowed this picture of vaccines and its strains from Dr. Naveen Koval. You can see the strain of BCG vaccine is Danish 1331. BCG. If we write in order, it is BCD. D for Danish 1331. Now, measles. For measles, M. Moraton, then E. Edmonston Zagreb, and S. Schwartz strain. Commonly, we have Edmonston Zagreb strain. Then for mumps, just imagine Jerry with a parotid gland. So it is Jerry Lynn strain. Now rubella, R and A, RA 27.3. Then JE vaccine. Japan is in Asia, and we can write Asia in a jumbled form as SA 14. So SA 14 14.2. Now rabies. Imagine multiple pits on a man after a dog bite. So it is Pitman-Moore strain. Now for cholera, we can write it as coral. Collar can be jumbled and write as coral. So Dukoral strain. Now chicken pox. Chicken pox, the strain is Oka. O is resembling an egg. And in yellow fever, we can write it as YFD, which can be like 17D. So the answer is 17D. Which of the following is a live attenuated bacterial vaccine? Let us see about the live attenuated, inactivated or killed vaccines and toxoids. In live attenuated, we have BCG, typhoid oral, OPV, yellow fever, MMR, chickenpox, influenza and epidemic typhus. So in this, the yellow colors are bacterial vaccines, which are BCG and typhoid oral. The green colored are viral vaccines, which are OPV, yellow fever, MMR, chickenpox and influenza, and epidemic typhus is a rickettsial. Now, in inactivated or killed vaccines, typhoid, cholera and pertussis are bacterial vaccines. Rabies, IPV, influenza, hepatitis A and B, JE, KFD and Covaxin are inactivated viral vaccines. The toxoids are diphtheria and tetanus, which are bacterial vaccines. Now, an additional point, Covishield is a recombinant viral vaccine. So the answer for a live attenuated bacterial vaccine is BCG vaccine in these options. Effective vaccine is available against all diseases except we can eliminate from the options. We know that KFD, yellow fever and typhoid fever have vaccines. So the remaining option is leishmaniasis. There is no vaccine available. You can follow me on Telegram. If you like this video, please subscribe me on YouTube. The slide shares for different topics in community medicine are available. Please follow me on SlideShare too. Thank you.